All right. A very good evening to one and all present with us today. I am Aditi Nanda. I'm a BDS student currently doing my internship from Baba Jaswant Singh Dental College, Hospital and Research Institute, Ludhiana. I'll be a host for today's webinar. I cordially welcome each and every one of you for today. We have Dr. Vishwas Narang with us, ladies and gentlemen. Hello, sir. How are you?
Hi, Aditi. How are you?
I'm fine, sir. I'm fine.
Yeah. First of all, I would like to appreciate the effort made by DentistChannel.Online for enlightening all the clinicians about these webinars. Thank you so much.
Right. Thank you so much, sir. I warmly welcome you on the behalf of DentistChannel.Online and also extend a heartfelt gratitude to you for sparing your precious time to be with us today. Thank you so much, sir.
Well, it's always welcome.
Right. So before we begin, I must introduce Dr. Vishwas Narang to all of our participants today. Dr. Narang is a third-year resident in the Masters of Dental Surgery in the field of prosthodontics. He completed his graduation from Gyan Sagar Dental College in 2017 and is currently pursuing his master's from the very renowned Baba Jaswant Singh Dental College, Hospital and Research Institute, Ludhiana. He is proficiently trained in the field of implant prosthetics and holds a keen interest in maxillofacial prosthetics. It may also interest our audience that Dr. Narang introduced a novel technique for denture identification, which I happily share got published in the Journal of Indian Prosthodontic Society in 2021. Dr. Narang is presently working on a uniquely customized technique for recording implant level impressions, the insights of which he'll be sharing with us through his webinar today, Demystifying Implant Impressions. So before we begin, I must let our participants know that they can put in any queries that they might have during the webinar in the Q&A box given below. They will all be addressed in the end. So, all right, sir, I think we are good to go.
Yeah, thank you. Thank you. Can you see my screen now?
Yes, sir, I can see it.
Okay, so today I'll be speaking on topic demystifying implant impressions. If we talk about a decade or two back, implant dentistry was treatment of choice for elite population only. But the recent turn of events like increase in number of systems and decrease in the cost and increase in demand have helped bring implant dentistry into general dental office. So talking about statistics, it has been observed that prevalence of implant among adult missing any teeth has increased from 0.9% in 2000 to 5.7% in 2015. And the estimated increase is to 23% in 2026. So you'll be also be shocked to know that today approximately 4,50,000 osseointegrated dental implants are being placed every year and with a success rate of 95%. So this change in paradigm shifts demand every dentist, irrespective of their specialty. For nowadays, it doesn't matter if you're a prosthodontist or an oral surgeon. You must know how to place or maybe how to take an impression of an implant to treat the general population that your clinic is going to visit. So why is impression making important? It helps to accurately record the coronal portion of the implant, which is the head of the implant, to other structure within the oral cavity. Like in the first image, we can see the implant is placed inside the oral cavity. We want to replicate its position exactly onto the cast. That is the motive of, basically the motive of taking an accurate impression. If we don't follow this correctly, what complications are we going to face? So the first are the mechanical complications. It could be screw loosening or fracture of the screw, occlusion inaccuracies, bending or fracture of the implant. Or it can be biological complication like marginal discrepancy leading to peri-implantitis or excessive loading leading to affected osseointegrity. So one complication we talk about are like ill-fitting prosthesis that you will be facing right away. But there are some complications like screw loosening or fracture that you will be observing with the course of, with the course of a period. So you'll be getting your patients again and again for retreatment for screw loosening or all these problems if your impressions are not made correctly. So before we discuss all the materials and everything that we require, we must be aware of the armamentarium, or we can say the components that we require for making an prosthetic impression. So it could be prosthetic components or impression materials. The first we are going to talk about is an implant driver. It is basically a screwdriver, and it is a critical piece of equipment used to screw and unscrew various components onto the implant head. Depending upon the implant system, it can either be a hex, or it can be a slotted, or it can be a star shape. So these drivers are specific to a particular implant system, and so are their analogs. Analogs are these small yellow and pink components that you see on the screen. So these are basically going to be placed inside the cast. These so-called analogs are going to replicate the position of the implant from the oral cavity into the cast. Now we have the most important components, that are the impression coatings. So these can be either closed tray or open tray. So closed tray are retained in the mouth once the impression is removed, but the open tray coatings, they are picked up into the impression once the impression is made. So comparing these two coatings, the open tray, we can appreciate that it has a tapering design that will help it to easily get free from the impression once it is set. Also, you can notice there is specialized geometry. This geometry will help you to replace these copings once the impression is made into the set impression. I'll be explaining that later. The other is a open tray coping. So these you can see on the right side of the screen. These copings have a deep undercut. So this undercut will help it to engage into the impression while it is removed from the oral cavity. Other components that we may require are stock abutments or the custom-made abutments. The stock abutments, they are pre-manufactured by the company, and you'll be receiving this in particular heights and in particular collar lengths. So they have a wide range of selection as well. They are relatively cheap. Also, you can use custom abutments, which will provide you excellent aesthetics and can be used in cases, for example, a very deeply submerged implant. So these copings, they are fabricated with the process of CAD/CAM, or they can be 3D printed with the help of DMLs. Now, talking about the impression materials. So I personally prefer using addition silicone because it provides me adequate time of 2 to 4 minutes. Also, the contraction is least, which is 0.1 to 0.7%. Also, in addition silicone, there's no byproduct, so the impression can be poured with a certain amount of delay. When we compare this with the condensation silicone, these materials are definitely cheaper, but they have a byproduct of acetone. So it can lead to the dimensional inaccuracies in your impression if they are not poured right away. So now we'll be discussing various impression techniques. They can be either abutment level or implant level. The implant level impression can further based on the copings, as you may already know, open tray and closed tray. So a patient normally requires prosthetic care after the second stage of the implant surgery. Most common finding you will be observing after the second stage is healing abutment placed onto the implant head. So the first step that we do is we remove these healing abutments and we expose the implant head. After that, we can use either of these three pathways. The first would be directly, seating a prosthetic abutment and taking an abutment level impression. This is most preferred method by the clinician that are you can say non-prosthodontists, because this is the easiest to apply. It basically works in the conventional FPD manner. Or we can simply apply a closed tray or an open tray and take the following impression. First, I'll be discussing about the abutment level impression. This technique uses a routine crown and bridge approach. So this is exactly how you take your FPD impressions. So you remove the healing abutment, you attach the prosthetic abutment, and you straight away take the impression. I'll be showing this case. So the armamentarium required for this was a torque wrench, implant driver, and prosthetic abutment. So the patient was referred to us after the second stage surgery in 4546 region, with the healing abutments were present. So the first step we did was we removed the healing abutment and we replaced it with the prosthetic abutment. After that, we took a IOPA to verify the proper seating of these abutments onto the implant head. After that, we observed that there is a slight change in the angulation, which could lead to a non-linear path for our final prosthesis. So we grinded the stock abutment with the help of a high-speed air rotor to obtain a single path of insertion. Once it was achieved and we reduced the height according to the space of the restorative material, we directly used addition silicone light body and putty consistency to take a abutment level impression. So indication of this technique is in case of unknown implant system. So in your clinic, you might face some patients that have already undergone treatment from some other clinic and want the replacement of the crown. So in these cases, you may or may not be aware of the available implant system. So in this technique, by this technique, you can directly take the impression of the abutment and can give a crown in a normal FPD manner. Also, if there is an unavailability of the required impression coping, we can use this technique. But the disadvantage of this technique is that it is less accurate and it does not allow us the flexibility to change the abutment later on. So when this disadvantage was considered, it was found that you may or may not need to change the abutment based on your case. So I always prefer to take implant level impression. So these impressions give greater flexibility for selection and modification of abutment. Also, there are two available techniques under this, that is closed tray and open tray. First, I'll be discussing with you the closed tray. So in this technique, the impression coping remain inside the mouth once the impression material is set, and it can be used with both custom and stock trays. So the basic workflow involves removing the healing abutment, placing the open tray impression coping, making the impression with the help of your material of choice, and finally placing that impression coping into the set impression material. So this is the case, the same case. In this, we removed the healing abutment and we replaced it with closed tray copings. Once the copings were secured with the help of the screw, we did an IOPA to verify its proper seating. Then we used again addition silicone material to make the impression of open tray impression of this. Now, once the impression is removed from the mouth, in the third picture, you can appreciate that the impression copings are still inside the oral cavity of the patient, whereas the specialized geometry of that coping is replicated onto the impression. So after this, we attach an analog. So this is a closed tray impression coping, and this is an implant analog. So this is how you secure them with the help of a screw on the other side. This is the implant driver screwing the closed tray impression coping. So now the specialized geometry I was talking about, that will help us reseat this coping into the impression. And that can be verified with the help of a click. A clicking sound will tell you that the impression coping is right into the place. The indication of this particular technique is in case of single implant impression, in restricted mouth opening patient, in patient that have severe gagging problem, or if you are doing the impression of, say, posterior region. The disadvantages with this technique is that it is there could be inaccuracies in placing the impression coping back into the impression. So it is a little bit tricky task to follow. So there could be a discrepancy in replacing the impression coping back into the impression, and that can finally lead to your ill-fitted impression. So now we'll discuss the open tray technique. In this technique, impression coping is incorporated into the impression. So in the last technique, we observed that impression copings were inside the mouth, but with open tray technique, these copings will be picked up within the impression. So both custom and stock tray can be used after cutting channels. So these channels will be required once the impression is set, so that the impression coping can be unscrewed. The basic workflow involves removing the healing abutment and replacing it with the open tray impression coping, followed by your impression. And once the impression is set, we unscrew these copings and then remove the impression. So for this, we require specialized trays, the trays which have windows in them. So you can either use custom trays and can make a window with the help of acrylic resin, and window can be made with the bar, or you can use a stock tray, that is the conventional trays, by cutting a channel in it, or there are specialized trays available nowadays, which allows a particular segment to be removed and impression to be made easily. This is the same case again, and in this we have made the impression with the help of a open tray coping. So the armamentarium required for this was torque wrench, implant driver, open tray copings, and analogs. So first we saw the healing abutments in the place, and we removed the healing abutments and exchanged them with open tray copings. Once that was done, we took an IOPA to verify the seating of the impression copings. Now, in open tray impression coping, it is normally recommended to do the splinting. So in this case, I have done the splinting with the help of an orthodontic E-chain and a flowable composite resin. So I applied the E-chain onto the impression copings and secured them tightly. After that, I used the flowable composite and light cured it to obtain a rigid splint. So this is my stock tray, which has a window in it, and you can appreciate that this window can easily be used to access the components on the implant. Once this was done, we took an impression with the help of light body and putty consistency polyvinyl siloxane. Once the impression was in setting stage, so I used my thumb to remove the excess material from the guide pin of the open tray coping. Now this will help me to engage my driver and unscrew these copings. So once they are unscrewed, we remove the impression. And once the impression is out of the oral cavity, you can appreciate the impression copings are within the impression, and the implant in the oral cavity, they are exposed. So this is how we attach analog into the open tray. So this is the coping. You can appreciate the undercuts that will help it engage the impression material. And on the back side of the impression, you can see the channels from which they can be screwed and unscrewed. So we apply the analog onto the position. Once it is properly seated, we seal it from the, so we secure it from the back with the help of the driver. And this is how you apply analog to an open tray system. So once everything is done, the prosthesis is ready. We apply we secure the prosthetic abutments, and we then finally cement the prosthesis. So the indication of this technique is it can be used either in single or multiple implant impression, and it can be used in implant where in the cases where implants are placed at an angle. So the disadvantage of this, it cannot be used in a restricted mouth opening patient and with excessive gag reflex. Since we know a driver will be used once the impression is set to unscrew the copings, it can lead to a problem with the patient who have a excessive gag reflex, or those patients who have a restricted mouth opening. But this technique is considered to be the most accurate. I'll be supporting myself with some studies later. There's another technique which is called snap fit impression technique. Now this technique is not available with all the implant system and manufacturers. It is not worldwide available, but still it is considered as a quite accurate system. So in this we have two parts. One is the prosthetic abutment, and one is a plastic impression coping. Now this impression coping can snap fit onto the abutment, which can be used to orient the abutment and analog assembly into the impression. So I'll be discussing this case in which we require torque wrench, implant driver, snappy abutments, snappy impression copings, and implant analogs. So in this the first image you can see healing abutment in place. So it was replaced with the snap fit abutment. Now this snap fit abutment, the seating of it, which was verified with the help of an IOPA. After that, we apply the snap fit impression coping, which will give a particular click that will make us certain that it has secured into the position. Once this is placed, the impression is made with the help of any material of your choice. And when the impression will be removed, we can see that the impression coping gets transferred into the tray in the impression, just like the open tray system. But there's no window, so it is basically hybrid of open and closed tray system. So once this is, the analog is attached onto the prosthetic abutment, and this assembly is placed into the impression coping. After that, the prosthesis can be delivered. So advantage of this technique is that it is time saving, it is easy to use, convenient to patients and clinicians both. Disadvantage is that this system can either dislocate or dislodge while making or removing the impression. So it can lead to some problem with accuracy. Now, finally, we have the digital impression technique. So, since we are living in the digital era where we are using 3D printed custom guides to place implants and the whole workflow is going digital. So, impression making with implant dentistry has also gone digital. This can be done with the help of a specialized impression coping called as scan bodies. So, these scan bodies can secured onto the implant of a fixture head by your screwdriver, and after that the impression can be made with the help of a digital intraoral scanner. Once this is done, a whole assembly of different system is available into the CAD/CAM softwares that can help you select the analog according to the size of the implant and can finally help you either 3D print a model or fabricate the prosthesis directly with the help of a milling unit. So there are some tips I would like to share for making an accurate impression. First is checking fit. Always make it a habit to check to do an IOPA to verify the fit of your components. Either you are going for an impression coping or you're going for a prosthetic abutment. Always make an IOPA to verify that it is completely seated, because even a properly made impression will lead to inaccurate restoration if the prosthetic abutments or prosthetic components are not properly seated. So in the first image, we can see there's a gap between the implant body and open ray impression coping, which was then correctly placed. And in the second image, we can see that gap is not there. Another way for making accurate impression is going for splinting. So the underlying principle is to connect all the impression coping together with the rigid material to prevent individual coping movement. So if you take an impression with where splinting is not done, the impression copings can be rotated within the impression. There is a chance for them to get rotated. But if you have splinted all this coping together, that 3D rotation of the coping can be prevented certainly. So the aim of splinting is to stabilize these coping during the impression making to prevent movement of these coping, and also there could be some movement due to say polymerization shrinkage of the material. So that can all be removed with the help of splinting. So for splinting, there are various methods are available. You can either go for your normal dental floss followed by fast setting acrylic resin, or just like I explained with the orthodontic E-chain and then composite resin material. Also, some authors have shared techniques where they use discarded metal burrs and metal pieces or orthodontic wires. Recently, this specialized impression coping was introduced by Austin. So they have given a large round undercut into the coping. So they claim that this undercut will engage the impression material, thereby completely eradicating the need for splinting. So since we are living in the era where evidence-based dentistry is practiced everywhere, so we must know some evidence which supports which impression material or which impression technique to use. So the first question is which material to use. We in 2000 did an in vitro study to compare and evaluate the accuracy of implant impression made with different materials. So they used polyether, addition silicone, condensation silicone, and polysulfides. So they finally concluded that medium consistency polyether and high consistency addition silicone is recommended rather than using polysulfide and C silicones. Now, other question is whether to go for splinting or not. So in this study, 3 different impression techniques were evaluated that were non-splinted, acrylic resin splinted, and indirect snap fit techniques for different angulations. So they finally concluded that splinted impression technique exhibit a higher accuracy than other techniques that were mentioned. Another question is whether to go for conventional technique or a digital technique. So Agne and others in 2019, they did a study to compare digital versus conventional dental impression. So they made impressions by open tray technique and splinting as conventional methods, and scan with Trios 3-shape scanner as a digital method. So they concluded that conventional impressions made by the pickup technique were found to be more accurate. The accuracy of digital impression showed the poorest result, and they were rendered clinically unacceptable. So although we are on the path to a digital dentistry, but still there are some limitations in using digital pathways. So finally, I would like to conclude that accurate impressions and meticulous attention to detail provide foundation for successful implant prosthodontics. Open and closed-way techniques have their respective merits and drawbacks, and the decision of whether to choose an open or a closed-way technique is down to the clinician's preference. But there's inaccuracies can be minimized with the help of using verification jigs, and also to ensuring that the analogs or implant replicas are placed accurately into the impression. This is the first article on implant impression that was published in 1952, whereby the technique they described was by removing the flap and then taking the impression of the naked bone. So definitely we have gone a long way from that to open and the closed way copings, and finally the digital pathway that we can see nowadays. Thank you so much. These are my references if you want to go for further reading. Thank you so much.
Thank you so much, sir. It was indeed a very interesting, very well formulated and very informative presentation. I remember my final year and how I could not even make up the heads and tails out of implantology. So thank you so much. Thank you so much, sir. You literally demystified implant impressions and made them a piece of cake for us. And we have indeed come a long way from 1954 to 2020. Thank you so much, sir.
Thank you so much. I would also like to thank DentistChannel.Online for giving me this opportunity and helping me put my views about implant impressions out in the public. Thank you.
It was a pleasure to have you here, sir. So before we proceed to the Q&A session, I have a little something to present. Although most of our attendees are already our Prime members and active subscribers, but for the new faces that we have today, I must introduce you to Dentist Channel Online. Dentist Channel Online is the first digital dental media, and we stand strong with our motto, healthy smiles, wealthy lives. Just a minute. So at DCO offer a wide spectrum of services for dental professionals, dental students, dental organizations, and dental businesses as well. You're most welcome to visit our website, www.dentistchannel.online, for the insights of each of the services that we offer. I also take great pride in sharing that we have organized over 700 plus live dental webinars for 40,000 participants with speakers from all around the globe. We have also conducted 25 plus dental workshops and have uploaded 300 plus oral care videos under the campaign Save the Tooth. Dentist Channel Online has hit another major milestone by making their way to India Book of World Records for maximum speaker participation in any virtual dental program in oral implantology. So we offer multiple added benefits to our Prime members. You get personalized profile at our website and access to our webinars and dental courses with special discount offers. We provide certificates to each of our attendees for webinars, which exclusively contain a 1 CPD/CDE point. You would also get regular updates on news and scientific articles. You might as well get a chance to be a speaker at one of our webinars, and you may also publish your own videos on our website. This is the sample of the certificate that we offer exclusively to our Prime members. Each certificate contains 1 CPD or CDE point. You can become a Prime member by a mere sum of 799 rupees per annum. And you can avail a special discount by using my promo code AN100. We would also invite you for our upcoming webinars by Dr. Satish Kumar Menon and Dr. Vishnu on 25th and 29th of April, respectively. We would love your engagement at various social media platforms like Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, Telegram as well. And lastly, here is our address and contact details. We would love to connect with you. Thank you so much. We may now proceed to the Q&A session. Right. So, sir, the first question is asked by Dr. Naman. He asks, which is better, open tray impression or closed tray impressions?
Well, if we talk by the evidence, then if we are going for an impression with a single or maybe two implants at the most, then there is no statistically significant difference between open and closed tray. But if we want to go for a full arch impression, then definitely open tray along with splinting has shown better results than closed tray system.
Okay, all right. I think an open tray also gives us as an edge to precision. And I think that is ultimately that we strive for.
Definitely.
Right. And Dr. Jasnoor Singh Sidhu asks, why is splinting necessary?
Okay, why is splinting necessary? So as we all know, the impression materials that we are using with this are basically the silicone impression materials. So there's some tendency of the impression copings to get rotated inside the impression. So if we are going for a splinted impression technique, we are already splinting all the impression copings with each other. So once they are locked into a certain position, there is no chance of them getting rotated individually once the impression is completely set. So that is why splinting is always better than non-splinting.
Okay, thank you, sir. And Dr. Naveen Chauhan asks to elaborate prefabricated healing abutment index.
Okay, prefabricated healing. So there are two types of healing abutments. They can be either prefabricated or they can be custom made. So if we are talking about in anterior zone, so aesthetics is basically the main demand of the patient. So in that cases, we go for a custom made healing abutment that will provide us with a particular contours of the soft tissue, or what we call emergence profile. So it will give us the illusion that the crown is coming inside from the tissues, as if it is a natural tooth. So for that configuration to achieve, we use custom-made healing abutments. And if we are going for a posterior zone, so we can go for prefabricated these healing abutments, because in the posterior region, the aesthetics is not of that prime importance. So
yes, absolutely right. And we have one last question by Rajesh Sutaria. He asks, impression for single piece implant or basal implants?
Okay, right now we are mostly doing endosseous implants. So if we're talking about basal implants, basically the techniques goes again with the open and the closed tray system. So there's merely any difference except that the endosseous implants, the systems are more, the options are more, like I already discussed with the snap fit system, where that was additionally provided by some manufacturers. So the techniques and the principles are basically same for you.
Okay, all right. Thank you, sir. And I had one question of my own as well. So which splint is better? We talked about resin as well as we talked about used burrs. Which is better?
If you're talking about resin, we are all aware of the polymerization shrinkage that resin offers. So if we are splinting with the completely pattern resin or any acrylic resin, it will lead to some polymerization shrinkage and changes into the position. So either you can go for a technique where we once we have fabricated the splinting, we cut it from the middle and then reconnects it with the help of small amount of resin. So that will lead to the final polymerization shrinkage that will be counted only of the small resin rather than the whole system. Also, if you're talking about metal burrs, I personally feel they are the principle is very sound. They must be superior because we are using metal to splint everything, and metals, as we know, they are not going to shrink. So the only problem is we have to use small amount of acrylic resin to actually connect those metal burrs and pieces with the coping. So that might lead to some shrinkage, but I think that will be negligible compared to the whole splint made of pattern resin.
Okay, thank you so much, sir, for clarifying my doubt. And I think with this, we mark the end of our webinar. Thanks to each and every one of you for joining with us today. And thank you, Dr. Vishwas. It was a pleasure to have you with us. Thank you so much. Thank you, sir. So we may now end our webinar here. Thank you so much.